The member from Dufferin-Caledon.
Thank you, Speaker. I am pleased to stand on behalf of the Progressive Conservative Caucus to talk about my role in the Select Committee on Mental Health and Addictions. As the Chair made reference, we're all pretty proud of the work that we were able to do, the 23 recommendations that came forward as a result of this work. But I think I'd also like to touch on why I asked and why I was so interested in participating in this committee. I'm sure I am not alone in talking as a member representing your riding, where you try to assist family members and you try to help people who are looking for assistance with their family member, their spouse, their child, suffering from a mental health or an addiction. And what I quickly discovered was that there is very little help out there. I had far too many parents come to me saying that they wanted to get their 16 or 17-year-old assessed. This is not treatment. This is simply being assessed to find out what is happening with them from their health standpoint. And unfortunately, the further I delved into the issue, I realized that children, these 16, 17-year-olds, were going to age out.
Right. I just ask that those conversations taking place either become much more quiet or taken outside the chamber so we can all hear. Please continue.
As I was saying, so as a member of provincial parliament, you try to assist these family members, try to get assessments and treatments for their children, and I was quickly finding out that, in fact, there were not enough services available. Assessment wasn't going to happen until the child turned 18, aged out of the children's mental health sector, and of course then immediately went on to a waiting list for assessment under the adult mental health system. It was an incredibly frustrating situation, so when my colleague, the member from Whitby-Oshawa, brought forward the resolution in December of 2008 to study and thoroughly review the mental health and addiction system in Ontario, I thought it was a very good opportunity for all parties to come together on an issue that is troubling all of us. I am sure there is not a member in this House who has not heard a story, had to try to help a family navigate a system that is, quite frankly, far too fragmented to help anyone. So I do want to thank my colleague Christine Elliott for that work, and of course, as a result of that December 2008 resolution, it was passed unanimously and the Select Committee was struck. Because of my history of trying to assist families in Dufferin-Caledon, I approached the then House Leader of the time, Bob Runciman, and asked if I could participate, and here we are today, almost 2 years later. The previous speaker also made reference to the staff who worked with us on this committee. It was hard work. There was a lot of sad stories, a lot of tough decisions, and I am particularly proud of the work that Elaine Campbell and Carrie Hull did, assisting what ended up being 10 members with very strong opinions and very thoughtful deliberations, and I thought they did an excellent job of putting together our thoughts and our desires into a comprehensive but ultimately very readable report. The 23 recommendations, as we all know, were based on consensus. Again, rather an unusual situation in a chamber and in a legislative process that generally spends more time on them and us than it does on consensus building. I'm proud of those 23 recommendations. I'm not going to tell you that they came easily. There were some very good debates within the committee process, but ultimately I think those debates led to thoughtful and ultimately doable recommendations. Many of the hours that we spent debating and discussing what the recommendations could be or would be were not just pie-in-the-sky ideas. They were suggestions based on how can we do it, how can we make it better now. This is not a 20-year plan. This is not a 15-year plan. These recommendations could be implemented and done now. And I truly believe that if the various ministries look at them and review them closely, they will find that they are a reasonable review of what is the mental health and addiction system in Ontario today. The first main recommendation, of course, is the umbrella organization, the Mental Health and Addictions Ontario. And I think as you read the report, you will realize that many of the recommendations subsequently follow from the idea that we cannot continue to piecemeal mental health and addiction services in Ontario, that we need to have an agency that ultimately has control over all aspects of it. And the history of it, I'll briefly tell you, is we've seen some success with Cancer Care Ontario. I don't think there's a member who can say that cancer services in Ontario have not improved since the formulation of Cancer Care Ontario. We understand that every single mental health and addiction service or treatment cannot be in every single community across Ontario. What we do want to see and what we do agree with as a committee is that regardless of where you live, regardless of where those treatment services are, they should be available to you. And that's what we're trying to do with this agency that will ultimately be there to coordinate and ensure that access is available to all Ontarians. There's some great programs in Ontario. We saw some of them in our site visits, but ultimately it is not consistent across the province. For whatever reason, the community getting together or some funding available at a certain point in history, there are programs that are doing excellent work in pockets across Ontario. We want to ensure that those programs ultimately become available to all Ontarians. The other recommendation that I would like to touch on is peer support. There is a growing understanding of the value of peer support in all aspects of mental health and addictions, and ultimately healthcare services generally. I remember when I participated in the chair leader event in the spring, I spoke to the organizer, and they actively use peer support workers. What he told me was peer support workers, when there is a spinal cord injury, are there on site speaking to the individual who's had an injury within hours. And you think, initially you would think, well, that's a physical injury. They have to deal with the spinal cord injury first. But his point was, as a peer support worker, as a peer support advisor, they become part of that support system, part of that support circle that assists people as they are trying to navigate what is, for the vast majority of us, a very different experience. And I see a lot of value in using and utilizing those peer support volunteers and workers. And I'd like that is, of course, one of the 23 recommendations, and I'm hoping that that's something that we, again, can move forward with quickly. It doesn't take a lot of study. All you have to do is look at some of the other peer models that are taking place in other health aspects to see and understand how valuable it can be. And the benefit is that peer support, that circle, that assistance goes all the way through from when you're initially assessed, when you're choosing and deciding on your treatment. It can assist your family as they try to be part of your model of care, your assistance, and I see it as a very valuable addition. And I say addition because it is not a medical model. We're not talking about replacing physicians and first responders. We are talking about having an additional support system within helping people who are suffering through mental health and addiction services. While we didn't write the report with a vision of who's going to like it, who isn't going to like it, it was a pleasant surprise, shall we say, to find that within a day, 3 provincial umbrella organizations had applauded the Select Committee's report on mental health and addictions. And the 3 agencies were the Canadian Mental Health Association Ontario Division, the Ontario Federation of Community Mental Health and Addictions Programs, and the Peer Development Initiative. And I'm sure I'm not alone, as I'm one of 9 members of the committee, that I've also received a number of emails, a number of phone calls, had many individuals and family members approach me, had the chance to read the recommendations, the report, and are pleased with what we've come forward with. Of course, after their congratulations, their next comment is, so what's the next step? And this debate, engaging the rest of the 107 members of provincial parliament, is certainly part of it. But ultimately, we will be looking at the various ministries and the government to start implementing those 23 recommendations. There's been some movement and an announcement, I think within a couple of days, from the Minister of Health and Long-Term Care on the OxyContin and initiative, and that's a good step in the right direction. But again, I think I'd like to see a little more movement on how we can get that umbrella agency moving forward, and ultimately move forward on the recommendations, the other 22 recommendations. I don't want to use all of our time, because I know that the Vice Chair, my colleague from Whitby, Oshawa, would also like to share her comments. But in closing, I would just like to thank again the many family members, many agencies, organizations who took the time to appear before us, to open their agencies and their facilities to our site visits. It made our job considerably easier to have that easy, accessible access. You answered all of our questions and took a lot of time with us, and I do appreciate that. And I'll close with those thank yous.
Thank you.